I would support a motion going to council asking that we consider it and that we begin the city dialogue to contribute to a national dialogue on the decriminalization of heroin and other drugs.
That was the chair of Toronto's Board of Health, Councillor Joe Mihevc. He says it's time to move the conversation around drugs like heroin from criminal activity to a public health issue. Now, Mihevc says it's something that the Health Board has been discussing for some time and that it's something they've been actively discussing as part of the city's drug strategy.
It does no good to our society at large to have someone who is intravenous heroin user to basically slam the book at them and throw them in prison. And so it starts with that recognition. If you knew that you were not going to be charged criminally for possession, it will spark a different way of being. The same way that marijuana, the legalization of marijuana, is saying that activity that used to be underground now will be above ground and regulated and controlled, and we want to watch that very carefully to see whether it produces better public health results and safer communities.
Now, Mihevc says we're still a long way away from decriminalization, from it becoming a reality, but he says it's time to start looking at models that have been successful, and that's something those who work with addicts are echoing, pointing to countries that have found a way to deal with addiction through decriminalization.
Since 2001, Portugal has moved towards decriminalization and has implemented that in 2001. And from Portugal, a lot of the concerns were that there would be increased drug use, and that's a myth. So the instance of drug use has decreased, and now people have, instead of being incarcerated, more resources were directed towards expanding public health interventions.
Now, Mihevc says this is just the next step in the city's drug addiction response, which will also soon include the opening of 3 supervised injection sites.